Good morning, guys. Today we are telling about nutrition. Nutrition is the food and combination of the amounts of needed to the body. Its effects on the body. Okay. So definitions. We see the definitions. Then again one more definition for all the categories. Food is any substance and solid liquid that contain nutritions. Nutrition means substance digested that used to food the body. Then elements. What are the elements it will be made? It is simple means can substance can break to the anything in simply. Diet is selection of food to the each person. Balanced diet means it's contain all the nutrition correct amount of the needs the body. RDA it's recommended dietary allowance. It's guideline daily amount. Micronutrients macro. Micro means large quantity of fat or protein means like chicken like this. Micro means just vegetables. So need small quantity of the body. It's vitamin and minerals. Then composition. Composition is the make the nutritions. Classification is the dividing to the groups. Source means it's need larger stored nutrients. Function means it's nutrient in the body. Then proteins, fats, lipids, carbohydrates, minerals, elements, then vitamins, water. So carbon, hydrogen, oxygen, nutrition, the compositions. The protein is the nitrogen which is need to the growth. Elements to working for the amino acids. Amino acids will call for the proteins. Okay, that protein is two classification. It's a high biological value and low biological value. It's a second or first class like this. Okay, so what are the protein sources means? It's a meat, poultry, that fish, eggs, cheese, egg or milk. The plant means lentil, beans, peas, nuts and cereals. So less saturated fat and more fiber and cheaper to reduce. Okay, this is under protein source. So protein is the function is the growth of the all the body cells to repair the damaged cells, and hormones and antibodies are to make the bodies. Okay, so RDA means recommended daily allowance. It's a one kg per day, 1 gram per day for the kg for the body. Okay, so 1 gram proteins of the can release 4 kilo calories. It's a 17 kilo for the energies. Okay, lipids and fat and oils compositions. So lipids are called by fat when the solid at room temperatures, oils when they are liquid at room temperatures. It's made three elements: carbon, hydrogen, oxygen. It's glycerol and fatty acids. Okay, so lipids means fatty one, fatty two, fatty three. Then classification is saturated and unsaturated. It's animal fat solid at the room temperature. So this mainly fat and fish oils liquid will be there. So lipids means saturated fat found to the butter and sweet lard, wheat, cheese, yogurt and nuts. Unsaturated means it's seeds, cereal, soya beans, halabas, hackacodas. Then cooking oils and all. So lipids it release the heat and energy to the body. It's a insulate the body. The proteins dedicate the organs by kidneys and all. So it's delay hunger, add to flavor to foods. Benefit of saturated lipids means so omega 3 and omega 6 fatty acids reduce the risk of heart disease. Okay, and improve the brain functions and all. So carbohydrate, it's a single sugar unit. So rice and all everything we have the carbohydrates. Okay, then carbohydrate, sugar, starch and cellulose. Then sugar are found to fruit, honey, table sugar, cakes, biscuit and sweets, and fizzy and jumps. Starches is the bread and potato, pasta, rices. Cellulose means fruits, vegetables, whole grains and seeds, nuts, beans. So brown bread, brown rice, so everything will be there. So this is under carbohydrate foods. To supply the body energies and extra carbohydrate change to the fat storage. So that's why we are skipping to the fat to the diabetes patients and hypertension patients and all. Okay, vitamins for the good for health. It's a job to do the vitamins to supply the body. So it's a missing the diet of deficiency can disease will be occur. So vitamins means fat soluble, water soluble. Fat soluble means A, D, E, A, and water soluble means BC. So vitamin A, you people knows carrot and deep for sunlight and fish, everything it will be there. So more soluble vitamin eaten by the body stored to the liver. So overdose of the vitamins eaten cause hypervitaminosis. Water soluble vitamins are not stored in the body. It's too much eaten means it's removed to the urine. So important to eat water soluble vitamins every day. Okay. So this is the normal. What are the vitamins minerals into the body? It's a calcium, chromium, copper, fluoride, iodine, iron. So how much for men? How much for women? So which are the best source to then their functions? So this I can give. I send it PDF also, just go through that one. Okay, next we are going to the another class. Next is another subject for the healthcare services. So what is the healthcare system? It says total service to the all health disciplines. What is the purpose? To provide and care to the ill and injury patients. Okay, to achieve the optimal levels of the healthcare defined populations. So types of healthcare means public health, physician office, ambulatory care centers, occupational health clinic, and hospitals. So types of healthcare service: substance care facilities, extended care facilities, and retirement associated living centers, rehabilitations, home healthcare. This is all your people are now working. So you people can see the every healthcare facilities. Then types of care health service in the daycare centers, rural care, hospital service, crisis center, and mutual support to the self-help group. Okay, so what are the public health means? Established to the local, state, and federal levels. Physician office means primary care settings. So funds generally for taxes administration to select the appointment officials. It's a manager have their own office. Can be group of practice. It's a local department are responsible to the developing the programs. So it's a routine screening, illness diagnosis center. Just compare this one. How is the our any doctors will keep separate clinic or something like in the PhD. That is another you people just compare and write it in a while exams. So ambulatory care centers means it's provide the ambulatory care, have your diagnostic and treatment facilities, and team ambulatory care and replace to the term clinic. So occupational health plan means it's a setting for the employee health care. It's a recognize the value of health employees. So exercise facilities, health promotion activities and all we can provide. So hospital means it's a 12 bedded, otherwise 1005. Okay, it's multi-specialty. So governmental or non-governmental both is there. The variety of health services based on the size and locations. So subacute care facilities mean the patient with the acute illness, injuries, exaggeration, disease of the process generally more intensive or long-term care. Okay, this is the extended care facilities. It's a retirement of the geriatrics. Okay, so that extend facilities and retirement facility, what you are seeing there we are going to write the columns. So formally it's called nursing homes. It's a personal care to geriatric people. The elder patient will be there. So elderly means geriatric persons. So this is apartment and all is there. Na? So there they provide laundry services, nursing care, transportation, social activities. See here home. Uh, then rehabilitation centers. So independent communicated center to the special unit. It's restore the health and recuperate. It's drug and alcoholic rehabilitations. So this is home means service to the home, education to the client families, and acute chronic terminally ill patients. So daycare center to rural center. Daycare center for the kids, infants and children while the parents work. Elder care means it's available socializing exercise program to the stimulation. So counseling and physical therapy it's needed. Rural care means it's a provide emergency care clients to the rural areas. So nurses in rural setting must be generalized who are able to manage the variety of the clients to the healthcare problems. So hospital care and crisis centers. So hospital care services means what will give you travelers to sit. Care to provide to the home, other health settings. Service given to the terminally ill patients and family support and supportive persons. So improve and maintaining the quality of life. Crisis means provide emergency service 24 hours. People who have immediate crisis in any flood or any disaster, it's happened, it's a crisis. Okay. So this is the mutual support to the all self-group peoples. Deal with life crisis people and alcoholic anonymous. Okay. Next, we are going to the next subject. Whatever I'm sharing the PDF, everything I'm going to the tell about these videos. Okay. So today it's again we are seeing about mental health side. So maternal and health children's health care means mother, child, and societies. How they're facing to the societies. Okay. So definitions: the maternal and child health service can be defined to promoting and preventing of therapeutic and rehabilitation facilities for the mother and child. Okay. So what are the objectives will be there means reduce the maternal and childhood mortality morbidity rate and promoting the safety satisfying the safe sex life, regulate the fertility, child survival, promote and protect to the health mothers, to promote the reproductive health and ensure the birth healthy child and provide for GT. Okay. Then ensure the birth to the health infant to the every expect mothers. It's a goal to promote the healthy growth to the develop the children's. So identify the health problem to the mother and child. So prevent the malnutrition of the children's. Okay. Then family planning services. Then communicable, non-communicable disease to the mother and children's. So example AIDS and all that one. Okay. So educate the mothers to improve the children's health. Okay, first they will face the further nutritional problem. Nutritional problem is malnutrition and anemia will be there. Infection means RTs. So reproductive tract infection and sexual transmission. Okay, so infection with the genital and puerperal sepsis will be there. So maternal health problem means disturbance of the menstruation, mature gravida, adolescent gravida, adolescent parents problem, unregulated fertilities, abortions, complication of the deliveries, infertilities, uterine prolapse, cancer of the cervix. Then indicated of the MCH. What is the MCH? MMR, IMR. Then neonatal, it's a mortality rate and all, maternal mortality rate and infant mortality morbidity rate. Okay, so neonatal morbidity rate and under 5 morbidity rate, child survival rate, coverage indicators, knowledge, attitude, practice to the indicator. It's if you are going for community posting, you people just observe, then you can write. Okay. For first, we will tell definition, then we can objectives with goals, then indications like this we can write. Okay. So then recent trends of means it's a indications of care, risk up to approach, manpower changes, primary health care, and reproductive and child health. Risk means what are the risk we can approach. So home birth and all is risk to change. Okay. Manpower changes means population will change. Okay. So targets of MCH means mortality rate below 2, mobility rate below 6, and death rate 1 to 4 age groups. So size of family, birth of weight of the child, weight of minimum 90% total children, minimum 2.5 gram baby's weight. So according to that one. Okay. Then organization activities services mean it's a complete health checkup and care for the child and mother from the conception up to the birth. Conception up to started conception period, we will health checkup we should follow. Okay. If health problem anything related to mothers, we can study and analyze it. We give the care. Okay. Providing the education to the mother and child to regarding the health. Okay, training professional and assistant work and all can help. Okay, so rural health nurse and all they can help. So what first we can give direct care, managerial functions and educational function. So maternal and child services means it's a prenatal antenatal care services. So that one is internatal care services, postnatal care services, under 5 child health services. So this is all will be there. So antenatal service means first 20th weeks, second 30 weeks, and third 36 weeks. So what is the prevalence of mother delivery means health history, physical examination, laboratory examination, then lab test, iron and folic supplementation and all we should do. Then antenatal services and then antenatal care. That is care for women during the pregnancy. So primary the antenatal care is to achieve at the end of the pregnancy and healthy mother and healthy baby we can do. Okay. So immunization schedule for tetanus, then nutrition, family planning, self-care delivery and all. We given the some instruction, home visiting to the health worker, referral services. So risk approaches, I told severe bleeding and for the home delivery and all. Maintenance of record, home visit means it's backbone for the services. Okay. So internet services means the internet services we can clean the hands and fingernails and clean the surfaces for the delivery time and cutting and care to the cord. So normally we can physical process. That complication is the septicemia, then unskilled septic manipulations, tetanus neonatal. This is unknown. If your hospital is there, no sterilization, it will happen. Okay. Then advantages of the domiciliary services means mother delivery in the family surroundings your home, less chances to the cross infections, mother is able to keep high up on the children's. Then disadvantages, mother have less medical nursing supervision, mother have maybe less rest and resume the duties, so diet can be neglected. Okay, rooming in, keeping the baby room side bed is called roaming in. So they will ask rooming in. Okay, it's called for fear in the mother mind that baby is not misplaced in the central nurseries. Okay, that is the called rooming in. Then postnatal services. So it's a institutional care. It's a 1% of delivery abnormal requiring that services doctor institution can be high risk cases. Okay. So postnatal services mean care of the mother or newborn affected delivery is a postnatal care. Postnatal services, postnatal examination, HB examination, teaching postnatal exercise, family planning services, health education. So child aid services means it's a decreasing. So child aid services means the child health is a infant mortality rate, complete protection of the child, nutrition diet of two children, overgrowth of children, preserve and promote the health under five children, increasing the health level of children. So what is the service we can give? Immunization, breastfeeding, growth and development, personal hygiene, detection of the health problem and treatment. Causes of under five deaths is diarrhea, pneumonia, measles, HIV/AIDS. This is under normal causes of the under 5 years. So under 5 clinics means child guidelines clinic will be there. Okay. So it's growth monitoring, care of illness, preventive camp. Okay. So under 5 means aims preventive care, growth monitoring, care in illness. So neonatal care means yearly neonatal. The first week of the life is most crucial period in the infancy. It's establish and maintenance of the cardiorespiratory functions. So it's a maintenance of the body temperatures, avoid to the infections, establish safety, feeding regimen, yearly detection and treatment of congenital occurred disorders. So then immediate care means clearing the airway to the child. Okay, then mucus anything secretion. Apgar score 1 to 5 within the minute. Within a minute and within 5 minutes after birth we should take. Okay, this is the Apgar score. Okay, heart rate, absence, slow, over, respiratory effect, absence, slow, irregular, good crying, muscle tone, placid, some flexion and extremities, active movements, reflex sense, but no response, grimace, then cry, colors, blue pale and blue pink, extremities blue, completed pink, and total is 10, severe depression is 3, mild depression is 4 to 7, no depression to 7 to 10. Okay. Then maintenance of the body temperature. The body temperature newborn is between the 30 to 37 Celsius. Okay, it's important immediate to the after birth of child. Quickly try to clean and warped warm cloths. Okay, skin to skin contact breastfeeding. So breastfeeding is a neonatal examination measuring the baby height and weight, head circumference, identification of the any risk of the baby. Then late neonatal care. Okay, that is central we should avoid. Then what are the management? It will be there means care of the cord. That care of cord means the cord should be cut and tied to the stopped pulsating. Cares must be taken to prevent the tetanus of the newborn by the unsterilized instruments of the cord ties. Care of the eyes means eyes open and lid margin should be clean and wet wipes. Then inner and outer side. Okay. Care of the skin means after bath we given the warm water to remove the vernix and meconium, blood clots and all. Okay. Apply the some warm oil also. Then programs and schemes are support to the MCH means you know that all the scheme nowadays, Vande Mataram, Janavi Sureshna Yojana, skill birth attendance, home based newborn care. So this is all nowadays they for kids they brought for the schemes. Okay, thank you. We will see the next class.